Okay, let's talk about getting into a patient's chart from LaunchPoint. So you're going to want to go over here and click on the patient's name, and that will open their chart for us. We're just going to kind of start looking at all of the items over here on the menu. Starting at the top, our nurse workflow. So this is where we're going to go for discharge instructions for the patient and to take patient off the board once they've left. This is also a good place to look for a bedside handoff window, which would be this tab right here at the top, this ED nurse handoff, that you should be able to find all of the information about this patient that you need for an appropriate bedside handoff. But you have over here your discharge tab, which we will talk about discharging a patient later on as well. We have our quick orders tab, and you can place orders on the patient from here, or you can go to the orders over here. This is the workflow tab, so there are a lot of shortcuts into the chart from here. And then again, your nurse handoff. Now you can rearrange these if you want. You can get rid of them if you don't feel like you're going to use them. Let me show you how to do that. So we didn't mean to, but we accidentally clicked the X on that quick orders tab. So we go right back up here and we're going to click on that, and it'll put it back up here with our tabs. If you want that moved back where it was, just click on it and drag it over. There you go. So moving down, this Omnicell tab in the emergency department, we don't really use this. This is more of an inpatient function. This is where you're going to do the majority of your charting, your assessments, your lines and devices, your neuro stroke patients, your MI patients, all of that stuff is going to be here. And we'll go through that a little bit further as well in another video. Here we would have the MAR. Let me go to a patient that has some meds ordered so I can give you a better idea of what that will look like. Let's open this patient here. We'll look at this more. There we go. So you can see this patient has some Tylenol and a tetanus ordered, as well as some IV fluids. And I will show you in the next video as well how to chart the medications. Look at the orders tab here. Another thing that I wanted to show you, you can add orders from here. Click the add button up here. I want to make sure that everyone knows that this common ED orders folder exists. So let me show you what happens if we type in UA. You get all of these options here. How do we know which one we should be ordering? From this common ED orders folder, if you click on Common Lab, there's one option. This is the one that we want every time. It's much easier to use this common orders folder than it is to search every time for the appropriate order. This is also where you would document the patient's medicine history. So you're going to click that Add Documentation by History. Let's say the patient tells us that they take amiodarone tablet twice a day, and we have that 200 milligrams twice a day right here. We're going to make sure that all of this information down here is correct. And then go to your compliance tab and make sure that you select that they're still taking it as prescribed. Then you can go back up here and you can keep adding further meds, but if you're finished adding meds, you've got all of their list updated the way that they say that it should be. Then you can click Document History down here. And then your Med List tab right there. You can see that that updated their medicine list. You can also go here to this External RX History tab, do the drop-down menu. If you want to just look at their prescription history from the pharmacy, you can click View. Typically, we're going to click Import so that we can bring in any new medications that the pharmacy has on record to our chart. So when you click Import, I've been in this patient's chart, but usually a little pop-up window will come up and will say, you know, we have to make sure due to HIPAA laws that consent has been granted by the patient to open this. If so, we can click consent granted, and that will bring this window up. So almost all of our local pharmacies participate in this, where you should be able to pull up their list of medications from the pharmacy, and then you can pull those over from here into the chart. So moving down our medication list, this is just another tab on the left that will bring us to the same place that we were at in our orders tab. Just shows us that medication list again. Just a shortcut basically. Next one down is our notes. So this is where we're going to find our physician's notes, consult notes. You can find most patients will have an administration folder up here at the top, which is where you would find any code status paperwork, living will, things like that. If you yourself put in a clinical nursing note, you can then go back and find it here. In our diagnosis and problems tab. So the top part of this, our problem being addressed this visit, this is going to be typically put in during the triage process. But at any point during the patient's stay, if you need to add something to that, you can do that from here. Just click this add button. I just typed in shortness of breath and hit enter, and that brings up this search window. This is the one that we want. We're going to click OK and OK. And that'll add that into their visit list problems. Now, I'll show you in the next video when we do the triage process how that would normally happen. Down here in the bottom half of this window, this is the problems that will be entered into the chart by the provider. Next tab down is our allergies. So this is also something that would typically be addressed during the triage process, but you can go back into the chart at any point and modify or add. To modify, we would just right click on this, modify, and it'll bring up the window. You can change what you need to change. Otherwise, if we're just going to add a new allergy, again, these yellows are hard stops. So that's the bare minimum of information that you have to enter in here in order to save this. So we're going to say, type in sulfa, hit enter. We're going to select sulfa drugs there. Patient says they have hives when they take sulfa drugs. Type in hives, hit enter. We're going to select that, click OK. This is obviously a drug category. Then you can click OK and it will save this into their chart. Next is the histories. So oftentimes you are going to find that these lists are already filled out. This is something that typically our primary care providers do during visits to the office. If not, this is definitely something that we can enter. So you'll find family history. You can add family history of any kind of diseases. The next tab is procedural history, social history. And there's this implants tab. So this would be more for the surgical patient process, not so much for us in the emergency department. And then the next tab down on the left here is patient information. So this is our demographics. This patient normally would have a home address listed here, any phone numbers that they gave us, their medical record number and their FIN number, patient identification number, then all of their demographics up here. Then on the next tab is their visit list, and then their insurance information would live here. Then on that last tab, this is where you would find the primary care physician for the patient. Next tab down over here is the form browser window. So the form browser would be any kind of power form charting. So any forms that we just fill out information such as our triage, and I'm just showing you this form to show you. So this is a power form. It's already here. We just fill out information. So anything like these forms here, if you need to go back and make changes or just look at it, you're going to find them here in the form browser. Your immunization schedule. So it doesn't show this in the train domain for some reason, but in an actual patient chart, there's going to be a blue link right down here that you can click on and find any kind of documented vaccinations that the patient has had in the state of Iowa and then pull them over into the chart. MAR summary, so you can see what meds have been given. This is just a different look at our medication orders and administration. The results review. So in this tab, you can see all of the lab, the diagnostic testing, your vital signs. Let me just show you. This patient doesn't have anything in the microviewer, but this would be where you would look for culture results. Diagnostic results are here. So our EKGs, our imaging, if the patient had had a PCI and heart and vascular, if they had a cardiac stent placed, the report for that and the images would be found here in the diagnostics tab. Then there's our lab tabs. This patient hasn't had anything done in the last 7 days, but there are results within the last 18 months. And the rest of these you can look at on your own. We recommend that in order to look at the lab work and the diagnostics, we use the workflow tab. Show you diagnostics. So this is just kind of a better view of everything. But you can look at it either way, whatever's easiest. Then let's go here to our activities and interventions. So this is another one of those windows that we don't often use in the emergency department. It's better for inpatient nursing. So this is going to be a list of nursing tasks that need to be done here. You can look at this, but on the ER side of Cerner, most of this information we are going to find back out here from Launch Point in our task list here. So we don't utilize that activities and interventions tab very often. Our outside records. So this Commonwealth program that we use for our outside records, Sometimes you're going to come into this tab here and you're going to find that there's already a boatload of information that's been imported from outside hospitals. But if not, you can do a query up here. Just I'm clicked this once before, and because this is a trained patient, it's not going to give me anything. But on an actual patient, if you want records from the University of Iowa, we should be able to find those from here. And when you run this, it will bring up all of those chart options into a new window, into a list here, and you can click them all and save them. Save them into our charting. The media workflow tab here and the multimedia manager, you would go to one of these tabs to see if you had a patient who had wound photos documented. This is where you would find those photos, the media gallery. You can look at those here. And then down here, the very last tab is our documentation tab. This would just be another place to find, you can find notes here, you can find results here, and then you can also add a note from here as well. So our clinical note, and then you're going to select ED Note Nursing, fill it out, click Sign. And then if you'll notice up here at the top, you have all of this patient information. So just very quickly, I'm going to show you, if you click on the patient's name up here at the top of the chart, you'll get their general information. If you click on their allergies, you can also add allergies or modify them from here. You can click on, let's see, if you click on sex, if this needs to be changed, you can change that from here. You can also click on this encounter. So sometimes if the patient has an upcoming appointment in an office, it will default to that chart. It won't let you chart on that as an ER nurse usually. So when that happens, when you have odd charting things happening here, just make sure that you're on the correct encounter. If you come up here and click on this, and this patient only has one encounter, but if they had other encounters to look at, other office visits, other emergency department visits from the past, they would all be here. You're just going to make sure that you're on the correct date and the correct department. And then click OK, and it'll take you to the correct chart. And that's all we're going to look at for this video, and we will talk about charting on the patient in the next.